Braces are the rage today with coronavirus. Everyone's wearing masks. So I don't know if you've seen Invisalign stock, but it's through the roof. Their sales have like tripled over the last year. And that's because everyone is doing braces. When you wear a mask, you don't have to show your smile. It's the perfect time to get this done. So we do what's called Jaw Development Orthodontics, and it's a type of ortho that is very physiologically sensitive to the jaw joint and the posture and how the bite lands in relationship to all of that. And we start off with a lot of patients who are in pain with TMJ, and then we get them out of pain, and then we move their teeth into that corrective position that we got them out of pain in. And that's what we call Jaw Development Orthodontics. So these brackets are already placed by the lab, and they're already in what we would consider a perfect position for the teeth to get perfectly straight. This takes human error out of the equation. Then we place this right on, it goes right over the teeth. And they're in perfect position already, and go ahead and light cure, and that's how we set it. And we use a different type of bracket. It's a very high-end bracket. It's called self-ligating. What that means is that you don't have to use little teeny rubber bands or loops around it. The problem with those is that they fall off a lot and they're troublesome, and this is like a gate that just closes over the wire. And also when the tooth moves, we get more of a bodily movement. The tooth doesn't tip when it moves, and it just prevents so many problems from occurring, and it speeds up the process of the orthodontics so much faster with an excellent result. And you can see now when we pop this off, the brackets are perfectly placed on the tooth. This procedure is also, by doing it indirectly, by having the brackets previously set up in a lab, it's very efficient, and the procedure really only takes about an hour, and we do a perfect job. So it's super efficient, super quick, super perfect at the end. And when we do this kind of jaw development orthodontics, I call it like a 1-2 punch. We first bring the jaws out so that we can create a lot bigger, wider arch for the patient. And we move them out a little bit first before we do the straightening of the teeth. This helps the lower jaw find its way more forward, which is always a more healthier position. Not always, but most times it's a healthier jaw position for the lower jaw to come forward, give the jaw joint a little more space, and to keep the muscles in a more relaxed position.